Hi, I'm Dr. Gupta, an emergency department physician at General Healthcare. Patient Jeremy Rogers came into the emergency department, or ED, experiencing shortness of breath and chest pain. After triage and initial diagnostic testing, I want to admit him for additional observation. General healthcare policy requires the ED physician and admitting hospitalist to talk. So I need to connect with the on-duty admitting physician about Jeremy's case. Our hospital uses Spok for critical communications, which makes it easy for me to locate the right provider. Using the Spok mobile secure texting and communication app, I search for the admitting physician for cardiac patients. Spok pulls information from General Healthcare's on-call schedule for today and lets me know Dr. Baker is the person I need to connect with. I entered my message and hit send. Spok even knows which of Dr. Baker's devices to deliver the message to based on her status.
Hi, I'm Dr. Baker, a hospitalist on the cardiac floor. I received a secure alert on my smartphone that Dr. Gupta would like to admit a patient. I accept his message and click the number on my screen to call him for a consultation. Hi, Dr. Gupta. This is Dr. Baker. I just got your message about admitting a cardiac patient. What are the details?
Hi there. Jeremy came into the ED with chest pain this morning. Initial blood tests seem normal, but I'm still waiting on the CPKs to come back. The EKG has some ST depression compared to his last EKG a year ago. Based on his significant family history, I'd like to have him monitored overnight until all his blood work comes back. His father died of a myocardial infarction in his early 50s.
After talking, Dr. Gupta and I agreed to admit Jeremy. Dr. Gupta enters the admit to hospital order, and Jeremy's status is updated from an ED patient to admitted. I will continue to round on other patients, and the floor nurse will alert me when Jeremy is settled on the floor and ready for me to visit.
Hi, I'm Megan, a nurse in the cardiac wing of General. Room 202 is assigned to me for this shift. So messages about the room, from bed management updates and clinical alerts to nurse call requests, will be routed by Spok directly to my device. I just got a Spok mobile alert that a new patient is being admitted. I push the accept button to acknowledge that I will be taking care of Jeremy today. A few minutes later, I received a call from Katie, Jeremy's nurse in the ED, to talk about case details before bringing him up to the floor. Once Jeremy arrives in his room, his ED transport pushes the staff assist button and the call routes directly to my phone for fast response. I'm in room 205 checking Mrs. Johnson's vitals when the alert comes in. I accept the request and choose to connect with the speaker in room 202 using my phone. Hi, this is Megan. How can I help you?
Hi, Megan. It's Katie. I'm here with Jeremy, ready for a handoff.
Thanks, Katie. I'll be there in 5 minutes. I will finish caring for Mrs. Johnson, then swing by Jeremy's room for the handoff and introduce myself. When Dr. Baker visits Jeremy and writes his inpatient orders, she also orders a chest x-ray. The great thing about the Spok system is it allows messages to be sent to a variety of different device types like smartphones, pagers, and Wi-Fi phones. So, after Dr. Baker enters the x-ray order, our radiology transport staff receive an alert on their pagers to bring Jeremy down to radiology for the test. Back in his room after being scanned, Jeremy pushes the ice chips button on his nurse call device. The Spok system knows that John, Jeremy's nursing tech, can handle that request and forwards the message directly to his device. Spok Mobile's alert lets John know which room is asking for ice chips. After verifying that Jeremy can have ice, John goes to room 202, and I remain uninterrupted while caring for another patient.
This is Dr. Baker again. I have been rounding on other patients after visiting Jeremy. Meanwhile, Jeremy's x-ray was sent to the radiologist for evaluation. The radiologist noted in the system that everything appears normal. With Spok in place, an encrypted message detailing the findings is automatically sent to my phone, since I am the ordering physician. I acknowledge the message, letting the radiologist know I have received and viewed it. The Spok system maintains a complete audit trail of the communication. By getting the results quickly, I can let Jeremy know that everything came back normal and talk with him about planning our next steps. With Spok supporting my work, I'm able to spend more time at the bedside.
And patients like Jeremy receive better care throughout their stay.